We are facing some technical issues, but the IT department is trying to fix it. Everything will be okay soon. Give us a few minutes, please.
Welcome to another inspiring edition of the Nurses Diary webinar. Today, we are truly honored to host two distinguished professionals whose lives and careers reflect the very best of nursing. Mrs. Amina Hassan Bayeron, Fellow AIPH, and Miss Odekule Oyenike Rebecca. Mrs. Bayero is a nurse, midwife, educator, researcher, and public health advocate with over 3 decades of service. She began her career in 1989 at ABUTH Zaria and now serves as a senior lecturer at Amadou Bello University, where she has also led midwifery skills laboratory. With an MPH from the University of Roehampton, London, alongside multiple qualifications in public health, leadership, and innovative teaching technologies, she has published research on virtual reality in nursing education, sickle cell disease, diabetes care, and women's health, and authored key texts for nurses. Beyond academia, she serves as chairperson of the Professional Association of Public Health Nurses of Nigeria, PAPHON, where she continues to champion mentorship, community health education, and outreach programs. Joining her is Miss Odekule Oyenike Rebecca, a registered nurse and certified nurse anesthetist with over 13 years of experience in women's health, obstetric care, and anesthesia nursing. She holds a BSc in nursing from the National Open University of Nigeria, a midwifery certificate from Osogbo, and has served at Olabisi Onabanjo Teaching Hospital, Sagamu, where she gained wide-ranging experience across medical, surgical, pediatric, and theater units. Currently specializing in anesthesia practice, she plays a vital role in pre-anesthetic assessments, administration, intraoperative monitoring, and pain management, all while prioritizing patient safety and holistic care. She is highly respected for her empathy, professionalism, and collaborative spirit. Together, Mrs. Bayero and Miss Odekule exemplify the essence of nursing: knowledge, service, and compassion. Their work continues to shape the future of healthcare in Nigeria while inspiring the next generation of nurses to lead with excellence. And now, ladies and gentlemen, to take us further into today's conversation, the floor is yours to our moderator.
Hello, everyone, and welcome to this beautiful episode of Nurses Diary. I'm so happy to be here today, and of course, the topic we are going to be discussing today is burnout and mental health, how nurses cope under pressure. My name remains Amudat Abiodun, and I will be your host for today. And our special guests are already here, and I will like to on their camera, and also they are free to on their microphone so that we can start soon as possible. Thank you so much, um, Haminat Hassan and Oyekune Rebecca for joining us. I'm so delighted to have you here with us. Thank you so much.
Thank you for inviting us.
Thank you so much, Ma. So I'll start with you,
Okay.
Mrs. Haminat. Yes, I would like to start with you.
Yes, ma.
Are you? Yes. So let's begin. Can you please introduce yourself and tell us how you find your way into nursing and then through academia? Because I'm so interested in how you move from nursing to academia.
Mm. Okay.
The floor.
Thank you very much. Can you hear me?
Yes, I can hear you. I can hear you very well.
Okay. Good evening, everyone. I'm very glad to be here. In fact, I'm highly honored for having an opportunity to contribute to the experiences of nurses. As earlier mentioned, I am Amin Hassan Bayero, born in 1966. I had my primary education in the local government area primary school. I went to Queen Amina College Secondary School. My father was a pharmacist, my mother was a seamstress, and I'm married with 6 children and 9 grandchildren. I started my nursing in 1985, where I had my RN in School of Nursing, my RN in Bauchi State, but we kept moving around. I had my MPH in 2011 in College of Health Science and Technology, my MPH in 2017. I became a fellow in 2022. And last year I had my PGDE. That's a little introduction about myself. Mm, mm. So what led me into nursing? Are you listening? Can you hear me?
Yes, we can hear you. We can hear you. We are
Okay.
clapping. We are happy. Yeah.
So what led me into nursing was my father, because he was a pharmacist and he was working in the teaching hospital then. So immediately after
Okay.
secondary school, he took me to the school, yes, and school had already started 2 weeks on. So as soon as I entered the class, I fell in love with their uniform and I fell in love with the teachers, and the thing is still going on. Yes, I was 2 weeks late in the class, but I was able to meet up. I excelled in my exams. I passed my
Wow.
Hello, can you hear me?
Hello.
Yes, can you hear me? Is the
Yes, now
network?
we can hear you. Now.
Okay. So you
Yes,
had
now
how
we
I
can hear
entered
you.
school. Yes, I said I entered nursing through my father. Did you hear that one?
Yes,
Hello.
we had that. You fell in love with the uniform and everything. Yes.
Yes, yes, and everything went smoothly. I had no problem with my education, and I passed my nursing council after the first attempt. And I'm still here with by the grace of Allah.
Wow.
Thank you. So I should continue my
Alhamdulillah.
part in nursing. Alhamdulillah.
Yes.
So are you asking that? Yes,
Alhamdulillah.
I
And
should
how
continue, or you
you?
will ask the question. My part in nursing,
No,
any
I
experience
want to
from
know like how you.
Mm.
Yes, and how you move from nursing to academia.
Okay, I moved to academia after my husband retired, because we moved around Nigeria. So I moved into academia in 2006. He retired, and I came back to Zaria, in the FGDC Zaria. I was a school nurse in FGDC Zaria. So, and the department had just newly opened in year 2000. So they had only one clinical instructor, and she was a classmate when I was in secondary school. So when the school wanted to progress and employ another clinical instructor, She now came and met me in the school where I was working as a school nurse. So she said, why not come and join me in the academia? Because they are looking for somebody again. I said, I've not been in the university before. I've been in the clinical area. She said it's a good experience. So I went, we met the HOD and I applied. My application was taken to the VC without interview, we just because the HOD then was my
Thank you so much, Matt. Thank you so much. Wow, it has been a good journey. So now we go to the second guest, and I would like her to answer the same question also. So, our second guest speaker, are you there? Miss Odekune Oyenike, are you here with us? Okay, let me see if I can. If the moderator can, the IT, can you help unmute her? Her mic is, she can't unmute her mic. She's the OD. I can't unmute you from here, but I think the IT department should be able to do that. Yes, now I can see you, but the mic, we can't hear you. You are still muted. Okay, I was told I'm reading now that you are the only one that can unmute yourself. Can you please re-log in, come in back again, and then try to unmute? Okay, nice to see your face, Mrs. Aminat Hassan Bayero. Nice to see your face. Thank you so much for joining us. So, can you tell us, let's go on with you. Can you tell us how your path in nursing has been? Was there any moment where you feel like, yes, this is my calling? Yes, this is the profession I want. Like you got that reconfirmation that, yes, this is my path, and this is what I would love to do as a profession. Mrs. Aminat Hassan Bayo, the floor is yours.
yes, yes, I have a lot of experiences, but the one that really touched me, can you hear me?
Yes, I can
Can
hear
you
you,
hear
ma.
me? Okay, the one
I
that
can
really
hear you,
touched
ma.
me. Okay, I'm going on. I said the one I had a lot of experiences, but the one that really touched me was the one when I was called at 2 a.m. in the night to come and take a delivery of a woman, a neighbor, unprepared with nothing. She had nothing with her, and I had nothing. She was being attended to by a CHU. I went and met her on augmentin drip. I asked what was going on. She said that the woman had CPD. I said, why didn't you move her to the hospital? That there was no vehicle. On doing palpation, I realized that it was not CPD, it was full bladder. And there was nothing for me to use to
Wow.
empty the bladder. I now removed the drip, cut the given set, inserted it into the urethra. As soon as the bladder was emptied, the baby was slipped out. That was when I knelt
Wow.
down, I did my sujood, I tied myself. because this woman had a bad obstetric history, 10 years into pregnancy, 2 miscarriages, and this is the first one that is saying. And she's been mismanaged. And it was just a full bladder. You can imagine she would have had a ruptured uterus with that oxytocin going. So that was when I really felt, yes, this is my calling. I had nothing to use, and God was there with me, and just a simple giving pet was what I used to deliver that woman. And it was a mild resuscitation. The baby hadn't gone into asphyxia yet. Mild resuscitation, and everything was fine. So that was the time I
Wow.
really said, yes, this is my calling. Yes, ma'am.
Okay, thank you. Thank you.
Yes,
And
ma'am.
now, this my next question is going to take us to the topic of today, which is when we talk about
Okay.
burnout and mental health. Look at the
Okay. Okay.
situation you just talked to us about now. They called you at 2 a.m. Probably you might have a long day, and at 2 a.m. you are there saving life of a mother and a child. How do you deal with burnout? And of course, there has to be the mental health stress. Of course, you can't. There will be some um, good event, and of course there will be some really really bad outcome also, that you will feel like, oh my god, this is so terrible. So how do you deal with burnout and mental health? Because I like to sleep a lot, and I can't imagine someone waking me up 2 a.m. and I have to do what I have to do to save both mother and child. So how do you deal with
Yes.
this um burnout and mental health while you are still working mainly as a nurse?
Honestly, during my early years, up to the time I was 30 years old, I didn't believe burnout was existing because I was going on strong. I had the zeal. No matter at odd hours, I will be waking up and I will do what I can do. After I reached 40 years old, that was when I started realizing, yes, burnout really exists. The day I
Wow.
collapsed at work and was taken to the clinic, I was diagnosed with chronic fatigue syndrome. I now asked the doctor,
Wow.
what is chronic fatigue syndrome? He said, you have been exhausted for the previous years and you need to take 2 months leave. I said, I can't do that. He said, you either take 2 months leave or you cannot go back to work. So
Wow.
I took my annual leave because no government will give me 2 months leave. Everybody knows that. So I went back to my HOD. He gave me my annual leave. I went home. And as you said, I love to sleep. And I cannot take sleep medication every day. So I will take a hot bath. I will take a hot bath and I will lie down with my feet raised up for an hour or two. Then I will lie down properly, prone position, and I will sleep. But initially, before this time, after the diagnosis, I was given amitriptyline for 2 months. So, but I didn't take it for the 2 months. I took amitriptyline for 2 weeks to calm me down because it was that bad. I took amitriptyline for
Wow.
2 months, then it was stepped down. I stepped down to diclofenac and then paracetamol, and then I continued with the PAP.
I guess the network is bad again.
Yes.
A network.
Okay. Okay, you
Okay.
didn't hear the last part.
Yes, we didn't hear the last part.
Okay, I said after the first attack of the chronic fatigue, I now learned to delegate. Before I used to bring my work home because I'm in the academia. When I had the fatigue, it was in the academia. When I was at the bedside, I was a school nurse. Most of the time I was a school nurse. We didn't have a lot of work that will give me the burnout. It was when I joined the academia that the workload was so much. So I learned to delegate. I learned not to bring my work home, and I learned to take laxatives, not laxatives, sedatives, because I've been prescribed amitriptyline before. So I learned how to control my sleep and I learned how to control my work. Thank you.
All right, thank you.
Yes,
Okay,
ma'am.
we have Miss Odekunle Oyenike is back with us. Welcome back. So we would like to hear from her also how our journey to nursing started and how a little bit about herself.
Hello, good evening, everyone. I'm Miss Odekunle
Good
Oyenike
evening.
Rebecca. Yes, I'm a, I, I'm a nurse, anesthetics. I started my journey as a nurse after my secondary school, but actually, it was my father that pruned me for this nursing profession. Actually, if they
Okay,
ask
Daddy
me,
has
what do
been
you
wonderful.
want to be? I will always shout, I want to be a doctor. But my father prefer a female child to always go for nursing or teaching so that I will be able to take care of the home. So he now encouraged me to go for nursing as far back as 2004. And that is when I started my journey as a nurse. Getting to nursing school, I did not actually show interest in nursing because I looked at it as what is what is actually the things that it entails in nursing. But with time, I just fall in love with it somehow. I just find it that sometimes every mother must be a nurse. And there was a day a lecturer has to come to our class and tell me the importance of being a nurse in your family, being a nurse in your community, being a nurse to the society and to the nation as a whole. So from there, I find it as a passionable things to be doing, to give relief to those people in stress and also to be able to support people in every area of their life. So that is how I started my nursing journey, 2004. And from there, I progressed to my midwifery school. From midwifery, I went for my degree. After the degree, I started a bedside nursing with Olabisi Onabanjo University Teaching Hospital. So that is how I started my journey to think of what's next to do. From there, I'm a nurse anesthetics, and I still give glory to God because I'm actually enjoying the profession.
Thank you very much. And it's so nice hearing the story of both of you and seeing the influence fathers also have on their daughters. It's amazing when a, when you see fathers that are so involved in the career choice of their children. It's so good. Thank you so much. So the next question also to you, Mrs. Odekunle. Please, can you tell us, has there been a particular point or something that happened that made you know that, yes, this is my profession, this is what I want to do? Like maybe an event that, or a little story there that actually confirmed, like, okay, yes, this is it for me.
Actually, there has been a lot. In fact, the most interesting day was after my midwifery, let me say my midwifery class. I just graduated as a midwife and I was working in a private hospital. So on that day, we're having a patient that has hospital posterior position in labor, hospital posterior position, head up. So seeing that woman, I have to go to the
Okay.
woman, tell the woman that, madam, with your stature and the way you look like, that is my first day on board as a midwife after graduating as a midwife. That is my first job.
Wow.
So I move closer to the woman and I have to tell her, madam, with your stature and the way you look like, I don't think you will be able to make this baby. It is better, let's advocate for cesarean section for you on time so that you'll be able to have the baby and the mother. Immediately I say that, the woman has to fly out because that is my first day on work. Then I shut up my mouth. Then a doctor came in wanting to examine the patient. And I told the doctor that this woman with the position, with the saucer shape on the abdomen, that is telling you that this woman is having abnormal positioning. And let's do cesarean section for this woman. The doctor was like, it was the bladder that was full. So he has to pass catheter to drain the urine. I told him, if you pass catheter and you drain urine out, I will give you my first salary. If you pass catheter for this woman and you are able to drain urine, my dear, I will make sure I give you my first salary. The doctor was like, ah, you are going to give me your first salary? I say yes. And he go ahead and pass catheter. After passing the catheter, there was no urine that came out. The woman finally see that I was talking sense. From there, finally, the woman, when the baby was even having convulsive movement, I have to tell the doctor, this is convulsive movement. The baby is going to pack. The baby actually packed. They performed cesarean section for the woman. But right from that day, I was promoted on that day to be the matron in the labor ward in a private setup. So from there, I just find out that it was passion because they were looking at it that how can a new graduate midwife be able to do this? So it's very interesting. It's very interesting. It gives you the sense of
Wow.
belonging and actually boost up your morale that yes, I am something. So whenever they have any issue, they will actually want to confirm from me before they go ahead, despite the fact they are medical doctors. So I'm very happy for that.
Yeah, and I'm so super proud of you. And I love it when nurses know their onions, when they know what they are doing and they are so confident to say it out like, hey, this is it. And that is so beautiful. I'm so sorry the outcome did not it
Goes
was not
well.
a good one for the baby, but yes, you tried your best. And yes, just like I was asking Mrs. Aminat, I want to ask you because of course in that kind of a situation where the child is no more, somehow mentally this can be nurses. I've never worked as why I've never been in anything that has to do with midwifery, but I have worked with children on palliative care, and so far I have not lost any one of them because I work in the community. But yes, let's talk about this kind of a situation, this kind of experience. How stressful is it? Looking at the topic of today, the burnout and the mental health. Let's talk about it in your perspective. How do you cope with this?
Mm. Actually, burnout is psychologically depressing. In fact, sometimes it makes you lose interest in in your daily activities. It actually even reduce your self-esteem and feel like, no, can I still cope or can I continue? But most of the time, when I'm facing that type of situation, what I do is number one, I try to communicate it out. I communicate it out to my loved ones, people that are around me, tell them that this, I'm feeling tired, I'm feeling depressed, I'm feeling psychologically down, I'm feeling that I'm overwhelmed. And most of the time, it comes with a good rapport. At least I've been able to solve 75% of the problem by my active talking to people. And from there, I find out that communication actually goes a long way in solving burnout by talking to people, by talking to one's loved ones. it actually helps a lot. Then after using the method of communication, I make sure I take enough rest. I make use of my day off by taking enough rest with my day off. I don't use my day off with other social activities. I don't joke with it. My day off, I don't use it with other activities. And those that knows me very well in my working place, they know that once I leave the hospital complex, any problem you have, eh, that is hospital based, you have to wait till I come back. To come back to the hospital, then we solve hospital problem. So, and the ones at home, I face it when I'm at home. So I actually enjoy that principle a lot. Then I talk to God. That is the three ways of which I use to treat my own burnout and stress.
Oh, you actually share the same thing with Mrs. Aminat, because she was actually telling us also that even in academia now, she doesn't bring whatever is work home from.
Yes,
She
I don't
doesn't
bring.
bring whatever is happening at work. She doesn't bring the
No, no,
remaining
no.
work home. So she leave work to work and home to home. That is
Exactly.
amazing. And of course, now I'm trying to name that. And also, it's so amazing when Mrs. Amina was talking and she was like, she never experienced burnout until after the age of 40. Wow. Wow, wow, wow. I think that is also an advantage of being a young nurse. For me,
Mhm.
I became a nurse less than few months before I clock no few years before I clock 40. Yes, few years before clock 40. So of course, even while doing the clinical placement and everything, I was already feeling like exhausted, and so many so many things I experienced during my clinical placement kind of like stress me, because I kind of come home and I'm always kind of checking my kids' pulse at every time, checking are they breathing, how is it going, and everything.
Mhm.
So yes, it's so
Mhm.
amazing, and I love the fact when you were talking about having this task of you are always a nurse, you are always doing something, you are always nursing people all the time. Thank you so much, um, Mrs. Odekunle Oyenike. Thank you so much. Now, let's go back to Mrs. Aminat, if you are ready for us. Let's talk about innovation, adaptation, and your strength. Let's talk about how you have developed creative ways at work and of course, I know you are in Nigeria. There will have been times where you have to improvise, or you have to get your teams together to do something. So can you tell us how you are able to do this,
Okay, the network
Mrs.
was
Amna?
fluctuating. You were asking how I was able to improvise and face. Hello?
Yes,
Hello,
and
ma.
adapt creative ways. How you are able to. Hello?
Yes, I can hear how I'm able to
Hello,
create
can you
ways
hear
and
me?
adapt. Yes, I can hear you.
Yes,
Okay, let me start by saying
yes,
in
that's
Ahmadu Bello
great.
University, yes. Let me start by saying in Ahmadu Bello University, Department of Nursing Sciences, I can proudly say we have the largest number of student enrollment in nursing, sometimes up to 200 in class. And we deal with all the levels, 2, 4, 5, 2, 3, 4, and 5. And we have only 4 clinical instructors. So how we deal with this
Wow.
is, and we have lectures 9 to 12, then 2 to 4. But the funny part of it is not only our regular students that we look at. We have nursing council and we have distance learning students. Then we have foreign trained, and they are all addition to this 200. So how we deal
Wow.
with this is, yes, how we deal with this workload between the four of us. And let me add that we have a lab. We have only two demonstration labs, one for nursing, one for midwifery. And that is where we take our demonstration classes. We don't go to lecture theaters. We do our demonstration in the lab.
Wow. Network. Why?
Hello?
Hello. Yeah, welcome
Yes,
back.
yes, you can hear me. So how we do is we now extend the hours because we cannot jam them all together. We have the four, the foreign train, those that train outside have to come back for licensing again. So they are all additions. And then
Yeah.
distance learning center also send their students. So the how we deal with them is we now break the classes. We start early from 8 and then we close at 4. We break. And then how we manage the stress is we now move some of our extracurricular activities because it's not only teaching that we do. We mark scripts, we mark projects, we make rosters, we write letters for posting. So we moved all this to computerize so that we do copy
Okay.
and paste. Yes, when we do copy and paste, it makes things a lot easier for us. So these are some
Yeah.
of the things we do at work. Yes. Mm. I
All
hope
right.
I've answered the question.
Thank you
Yes. Mm.
so much. Yes,
Yes.
you
Mm.
have. Thank you so much.
Mm.
Thank you. God bless whoever started copy. Hey,
Yeah.
Miss Nikki, can you tell us, has there been any time maybe you are at work and you don't have all the equipment you need or you don't have all the tools you need and you have to improvise? What are the creative ways you have used to do things that is not supposed to, but you just have to do whatever you have to do to save the life of both the mother and the child?
Actually, that question was very interesting. Even that one, hello, hello,
We can hear
Hello,
you.
I can hear you.
you can hear me.
Hello, I can hear you.
That question was very
Yes.
interesting. I would love to say a story about a patient I came across. That was during COVID time that there was total lockout. So the patient was
Yeah.
just, this is not even hospital setting, was just passing by in front of my house and I was going out. When I have to see her, she was sent back from a primary health care unit because of COVID. They were not available, they were not present. So, and like the way the private hospital were not ready to receive her to take delivery because of COVID of 18. And looking at the way she was looking, behaving, I can see that actually this woman is about to deliver. My dear sister, I have to ask her, can we have a place? Then that turn me to a domiciliary midwife on that day. I turned to a domiciliary midwife in which there is nothing to work with. Nothing to work with. So we have to improvise, use blade to cut the cord after delivery. We have to use nylon glove with small glove to do, what do we call it, to take the delivery of that woman on that day. So that is the way I improvise for that woman for that day. But in the hospital setup, actually, nursing, we are good with improvisation, very good. I think the best thing nurses
Yes.
are good at
Yes.
is improvising. That is the first thing nurses are good at.
Yes.
And in everything we just know how to improvise, because I can't tell you that these things are available in the hospital setup. In fact, sometimes when you are in my anesthesia posting, when there is no oxygen, we take our humble bag to improvise for oxygen on time. So I can't actually say this is the limitation of which we improvise, yes or no.
Yeah, I think also as women generally also we are always thinking, and of course we improvise, but of course taking delivery of someone domiciliary, I can't even wrap my head around it. Great job. Thank you. Thank you for all you do. I can't even wrap my head around it because of course I am trained here in Europe, and I have been practicing in Europe, so of course there is little improvising that I can wrap my head around. And it's so amazing that you can actually do that. Like, okay, that is so really scary. Thank you so much. So now let's go to support system and career growth. Mrs. Aminat, you've told us how far I have read, of course, and you've told us how far you have grown, and tell us about the support system. And do you have a mentor? Do you mentor other people? Because believe me, somebody like me will want you to be my mentor. So I would like to know, like, the importance of having a mentor in the um, nursing career and having support system. Yes.
Okay, thank you very much. That is a very good question because from the day I entered the School of Nursing, the first nurse I met was she was a year ahead of us, and the uniform fed her very well, and she was doing yanga. Let me use our local language. She was doing yanga with it. So, not knowing that she was one of the best students in the school, so she at that moment she became my mentor. So I used to copy her without her knowing. And then I learned that she was topping her class. That was what initiated me to try and top my own class too. So she later became the principal of that school. You can imagine as I was
Wow.
following her, when I graduated,
I convinced Sama to come home.
Um, hello.
hello, network.
Hello. Yes, we are here.
Yes,
We are
can
very
you hear me
patient.
now? Yes,
Yes, I can hear
you
you
can hear
now.
me. Okay.
Yes.
So the mentorship I had was because at that time, for a Muslima to wear this uniform, short and with the cap with my hair open and probably walking, people now used to gather, you are Amina, you are from the north, this and that. So I had a lot of support, both at work and at home. My father, our family are from the Learned group. As I told you, my father was a pharmacist. So the first four girls he had, he made sure that all of us went to school. So I had my senior sisters to look up to. So because of the stigma that was in the north for nursing, I got married. I was married off to a polygamous setting. I became a second wife in my first year. Luckily, my husband was a very big support also, and we have been together up to
Wow.
now. Yes, so I had this support. Then currently now in the Department of Nursing, the HOD has been very supportive, honestly speaking. He was the one that encouraged me to go for the HND and the MPH and the PVD. So Allah has been surrounding me with a lot of support, both at home and in the working place. Thank you very much.
Okay, thank you. And thank you so much. It's quite I was surprised actually when you told me you loved the uniform because as a young girl my mom wanted me to be a nurse, but I hated the uniform. And I was like, no, there is no way I'm gonna wear there is no way I'm gonna wear that short gown. I actually grew up in the north. I grew up in Kaduna. So there was no way
Okay.
I'm gonna wear that and be doing nothing and open my hair and everything. So of course it was it is different for me. And
Yes.
yeah, of course, it's amazing that you actually got married in your first year and you are still able to go this far. It shows that nothing should actually stop a woman from achieving her goal if you have the right support system. Miss Oyenike, can you please answer the same question? Tell us about your support system and do you have any mentor that someone that you are looking up to?
Thank you very much. I have a lot of mentors that have always been encouraging me. Actually, I was at the bedside nursing before. I've worked through for like more than 13 years at the bedside. It was one of my best, my mentor that called me, though the person is not enough, was a doctor that asked me to come. That's but you are very active. You can go for anesthesia, and I say, oh, is there any course like that? Because awareness of anesthetics job and being a nurse anesthetics is not actually well pronounced in my locality generally. I can say in the community where I find myself. Peri-op is well pronounced, every other profession. But being an anesthetics, I find that is not well pronounced. And many people, most of the time when they come to the world, they used to think maybe we are doctors. So it makes the course a secretive thing somehow. So it was that doctor that asked me to go for anesthesia, of which I went and I came out with flying colors. Getting to anesthesia team, every members of my team have been so supportive. I really appreciate them because when I was in school, there was less opportunity to practice as a student anesthetics. But when I got back to my working place, actually it was another turnover. They taught me and I was able to gain a lot from them, even beyond what I've been taught. My ogas, they were very supportive. Very, very. Once you are ready to land, they are ready to give it to you proper. That is them. In fact, I will tell you in the areas of burnout in anesthesia, because we believe a sluggard, a tired anesthetics is a killer. So most of the time, when our ogas have seen that you've taken about 2 or 3 cases, they will come back to you and tell you, go and rest, I'm coming. And they will come and take over from you. Any procedure you want to do, they will stand beside you and say they want to do they want to be a supervisor unto you. And in fact, don't be scared. I used to tell my junior ones behind me, if your guy say do this, do that, you have a backbone. that will surely support you. So they have always been a wonderful leaders to us, and they were really, really supporting us in that our anesthesia team. Even in the ward too, they were encouraging. So these have always been my supportive system in her. And they I'm telling the young nurses now what they can do is that if they are actually patient enough, they will be able to gain a lot from those people that have been before us. With the spirit of patience, understanding, and gentleness, and they do away with pride. In fact, majority of our mentors, of our leaders that we see, they are ready to give it to us proper to understand. Thank you very much.
Thank you so much. I love the fact that if we are ready to listen and if we are patient enough, our leaders are ready to give it to us and they are ready to help us to grow. I like the fact that you are using give it to us proper, like properly, you will know. Thank you so much. And that is why I'm telling Mrs. Amina that she will be my mentor, though she has not accepted, but I will see, I will send her a message about this because I want her to give it to me proper. All right. Mrs. Aminat, please would like to know
Yes,
what
ma'am.
do you want the world to know about us, about nurses in Nigeria, about nursing education now in Nigeria. What is the message, the important message you would like to pass to this to the world about the nursing education in Nigeria? And like I said earlier, I was not educated in Nigeria as a nurse. So yeah, it's interesting to know. Mrs. Aminat, the floor is yours.
All this with inadequate remunerations because the Nigerian nurse is hardly paid what she's supposed to have. And sometimes
Mm.
you don't even have enough time to go and rest. Not as you said, organized in your area abroad. It is totally different here. You can be off today and somebody will fall sick because of the shortage in the hospital. And you will not be able to go and rest.
Network. Oh. Please, in the meantime, while we wait for Mrs. Amina to join us, if you have any questions for our nurses, please you can actually write it here in the chat box, or you
Hello,
can actually raise up your hand
hello,
at the end.
hello,
And
is the network.
yes, but now we
Hello,
can
can you
hear
hear
you.
me now?
Yes, we can hear you
Yes,
now.
is the network is protected? Okay. So in the clinical in the classroom now that where I am, we don't have most of our equipments are obsolete, and we don't have fancy equipments like you have. So most of the things, as she said when she went for her anesthetic training, we only tell them verbally because when we Google and we see, we sometimes we have links that we show them. We have a screen and internet provide provision for us. We tell them this is what you see, this is what you when you go to the hospital setting, this is what you see. But the actual practice is when you go out. So I want our counterparts abroad to have respect and compassion for us, and whatever they can do to assist us by, what can I say, supporting us with learning equipment. The most especially like me now, if I can have a seaman in my lab, I'll be very grateful. We don't have seaman, and I know you know what a seaman is, ma.
Yes.
Ma, you know what a seaman is.
No. What is that?
Okay. A seaman is a computerized patient. Is a computerized patient
Ah,
that you can
okay.
actually,
Yeah.
yes, yes. It's
Yes.
a computerized
Yes.
patient that you can, yes, you now know what it is. You can program it to speak, you can
Yes. We use
program
it
it to
for
have, yes.
simulation. We use it for
Yeah,
simulation. Yes.
we don't have it here.
Yes.
We don't have here. So most of our demonstration
Wow.
is improvisation, as she said. So we improvise. So I want those abroad, if we can have a philanthropist or somebody that can donate or give or something like that, so that we can.
Wow.
Hello.
Hello. Yes. We can hear
Yes,
you.
ma'am. Yes. Yes. So is there anything you want me to add apart
No,
from,
for now.
or did it
No,
break?
not
Yes.
yet.
Okay. Okay. Thank
No.
you.
Yeah.
Mm.
Yeah. Miss Oyenike, please, can you tell us what are you as a nurse, first as a nurse, midwife, and now nurse anesthesia? What do you want message for the world? Like,
Uh, as, thank you. My most important things in this area of anesthesia in Nigeria, and we find out that in Nigeria, most of our states, hospitals, comprehensive center have been much up by the nurse anesthetists. Apart from that, the education system of nurse anesthetists were only based on diploma level alone, which we wish to progress. People like me have been waiting a long time for masters in anesthesia. I think that is one of the things that was delaying the masters, not just masters in medical surgical, like those people in European country now, like US, Philadelphia, they will have their PhD in anesthesia, and they become a doctor in anesthesia as a nurse. They become a certified registered nurse anesthetics. Then they will have their doctorate in anesthesia. So they become a PhD holder in anesthesia. So what am I trying to say is that I will love Nigeria system to look into bringing the level of anesthesia to the master's and doctorate level. Is a specialty that actually needs an advocacy, because looking at it, when we are talking about those people in the European country, like epidural during labor, I think it's very good if Nigerian can also go into epidural for pregnant women during labor. But we want to do it, but who will monitor it? We love to
Nobody.
do it, but who will actually take control of it in the ward setting, in the bedside, when we say there is no enough even in the theater to do surgery? Then how will they actually do that at the bedside? So we are advocating for, if they can actually progress this program to the master's level, to PhD level, so that we can stand with our counterparts in other nations as a whole. So that is my issues about it.
thank you, thank you so much. And as someone who has been under the knife a lot of times when I was in Nigeria, I would say yes. I really appreciate whatever anesthetic is going on, because yes, have actually been under the knife couple of times in Nigeria, and they actually did a good job. And I know, as nurses also, I have a PhD in public health, and I'm a registered nurse. Though my own story went a different way. I was a nutritionist, a dietitian in Nigeria. Then I came abroad for PhD in public health. It was towards the end of my PhD I decided to go for a nursing degree, and I was able to combine both nursing degree and PhD, and I was able to finish both at the same time, almost I think the same
Wow,
time, because it's
that
just
is
a
this.
month difference
Mm.
between them. Yes. So yes, my story is quite different. And
Mm.
yes, I believe like when she was talking about Miss Amina was talking about semen, I don't even know what that is. But of course I now when she explained, I know this is something we use in the stimulation room where we kind of like this person we use it even for CPR to do the CPR and everything. So yeah, there are things that need to change also. And I believe even this improvising is good. It makes you think out of the box. But sometimes you might not get the desired result. Anything could go
Yes,
wrong at
yes.
any time. Complications
Anything
could
to
happen at
get
any
better.
particular point in time. And when you are improvising, you are stuck. Because yes,
Yes,
what next after that? Yes. And of course, as a nurse, of course, like I said, I studied here in Europe. I have practiced here in Europe. But sincerely, so many times when I see nurses from Nigeria, I know they know what they are doing. They are very
yes,
good. That is one thing you can't take away from nurses that are
yes,
actually
yes.
educated in Nigeria.
Nigerian
They know
nurses,
their
yes.
onions, they know what they are doing, they know the theory, they know the practical. The only thing missing are the tools in which to actually, of course, some of these tools that we use are quite new for them. So, but before you say Jack Robinson, the Nigeria mentality in
Yes,
us will stand
adapted.
up, and we are we are there and doing things. But me, even as an European nurse, I always say I still want to have time. I really wish to have time to actually come to Nigeria and see things and learn things. It's not just seeing. I want to learn things in Nigeria because I know there is the world is my oyster, and of course back home there are things that we are not exposed to here that is actually the problem of our people, like sickle cell anemia, for example. It is not
Mm.
a problem in Europe. So
Yes,
we were
yes.
not even taught during my
And
nursing
malaria
degree.
fever. Mm. Mm.
Malaria, nobody said anything about malaria.
You
Nobody
don't have
said anything
malaria
about
over there.
yeah. And the last time I actually went to Nigeria, I was actually asking my sister, teach me how you give all this injection in the box because we
Mm.
don't really. I think we did it once in class, this intramuscular injection, because it is not a thing except vaccination, and of course use the IV cannula at any point in time. I
Mm.
can do that with my eyes closed. I can always give IV. But you bring your box for me to put an injection there, I'm gonna go like, oh my god, give me a minute, let me go check what I'm gonna do with you. Of course, it that shows that when it comes to nursing, we can both learn from each other. There is so much to learn from one another, and of course, the new nurses. The last question would have been hope, change, and advocacy. But you women, let me not use the word ladies. You have actually answered so many questions without me even asking. Thank you so much. I really, really have a nice time with you. It is quite educative, quite informative, and really, really brilliant. You guys were on point at every particular point in time. Thank you so much for
Thank
giving
you.
us your time. Thank you. Thank you, because I know, of course, as nurses, we are always busy as women. We all have our different lives. We all have things we are dealing with in our life. And giving out a time on Sunday evening when tomorrow is Monday, it is not easy. Thank
Yes.
you so much. Thank you so much, Mrs.
Yeah,
Amina. Thank
you
you
are
so much,
welcome.
Mrs. Oyenike. Thank you for
You are
joining us.
highly welcome.
Okay, so
So, any
thank you.
final word? I would like to know. Do you have any final word, please,
Okay,
Mrs.
can I go
Amina? Do
ahead?
you have what? Yes, please go ahead.
Okay, I would like to, yes, I wrote something small. I said I would like to express my sincere gratitude to everyone who made it possible for me to share my thoughts and experiences. It has been a great honor to connect with fellow nurses and healthcare professionals. I want to leave you with a sense of appreciation for the incredible work that nurses do every day. Thank you for your dedication, compassion, and commitment to delivering exceptional patient care. Keep shining, keep caring, and keep advocating for a healthier world. Thank you and good night. Thank you for the
Thank
applause.
you,
Yes, ma'am.
thank you so much. Thank you,
Yes, ma'am.
thank you,
Yes, ma'am.
Miss Oyenike, sorry.
Yes. Thank you very much for giving us the opportunity to be able to say one thing about nursing and also to be able to advocate for nursing as a general. We really appreciate this platform to continue and to create awareness about nursing as a profession in general, so that from there people will be able to get awareness about the profession and be able to award what is due for the profession. And also for my senior colleagues that are here, I want to really appreciate you. And I don't want you to forget the slogan a that said a success without a successor is a failure. I want us to
Hmm.
continue to encourage the young ones about nursing profession, creating their awareness about the greatness in nursing, and also working towards making Nigerian nursing in general in the world to be the greatest in the future. Thank you very much. God bless you.
Thank you so much. And I believe anytime we call on you, if it is convenient for you, you will be able to come back. And of course, with me, Oyenike, we can talk more about nursing and anesthesia. I know there is so much you want to share. There is so much you. I can see the passion in you. And I'm sure if we call you back to talk about this, you will be very, very happy to join us. Also, Mrs. Aminat, you are a teacher. Of course, every nurse is a teacher. Somehow you are teaching, you
Yes,
are doing
yes,
patient education, you are doing that all
yes.
the time. And I'm sure next time we call you, next talk now on education, nursing education, you will be able to come. We will be
Inshallah,
delighted to have
inshallah,
you to us.
inshallah. Mhm.
Inshallah, inshallah. Thank you.
Thank you.
Mi kò yé nìkẹ́ ẹ ṣe gan-an, adúpẹ́. Um,
Yeah, you're
Mrs.
welcome.
Aminat, I will say now go dey okay.
Yes.
if I if my
Nagode
Hausa
sosai,
is not
nagode
right.
kwarai kwarai.
Yeah, now go dey
Okay, thank
correct. Ah, now go dey.
you. Yes,
Thank you
ma'am. Good
so
night.
much. Yeah, thank you all. And I'll see you next time, next month, by God's special grace. And remember, this is the Nursing Diary where all nursing stories deserve to be heard. And I love you, our audience. Thank you, our audience. Thank you for always joining us. This will be on YouTube also, so that you can share the link for the YouTube link, and people can watch even after today. And if you want to rewatch also, it is there, and you can actually share with your friends, share with your students, share with your mentees, share with your mentors also. Thank you. Share with your family, and we love you. Thank you so much. Thank you, Firot, for giving us this platform. We can't have this conversation without you. Thank you, Firot. Thank you for putting this together for nurses. Thank you for being our platform. Thank you, and see you guys next time. Thank you.
To, nagode.
Bye.